I am very proud to be standing where I am and will tell you all about it. And I'm going to introduce you. You are?
Sue Kiernan, Vice President of Development at Nathan Littauer Hospital.
Which means what?
I like to say if it has nothing to do with hands-on care of the patient, the building, or the employees, it ends up in my office.
That's a lot of stuff.
I do. I recruit physicians, I raise money, I'm in charge of advertising and marketing, community relations.
So you really know what's going on in this hospital?
I have to, in a general sense.
Not as a patient sense, but, well, even that,
well,
you have numbers, you come up with numbers, you know how many patients come through the emergency
and I've been a
room.
patient in here, both in the emergency room, and I've been a patient upstairs. My family members have, so I can speak from a patient perspective.
Just take a second. What would happen to Fulton and Montgomery County if this hospital wasn't here? In Hamilton County, what would happen to these three counties if this hospital were not here?
These counties would be in rough shape. It is so important to have your physicians local, know you, that can see you at a moment's notice. It's so important to have an emergency department when, you know, there are certain times when we can't wait. We need to be seen by a medical professional. Nathan Littauer Hospital has been here for 116 years. We started as a hospital, and we have grown to more than just a hospital.
Quite a facility.
Nursing home, 8, soon to be 9, primary care sites, outpatient sites, a big community education center. You know, we are part of the fabric of this community.
The building is great, the equipment is wonderful and state-of-the-art, but it's the people behind that equipment that make this hospital different.
It is, you are absolutely correct. You still need people who can, you know, turn things on, to read images, to be able to put that human touch into to you.
What would happen? Put yourself behind the counter. An ambulance pulls up. You're going to upstaff the emergency room, because that's where we are. We're in the new emergency room. What would you feel like when an ambulance pulls up and a patient gets wheeled out of the back of the ambulance? What do you think would be going through your mind?
Well, not being a medical professional.
You and I are not trained. You'd be scared to death, wouldn't you?
I would, but I think instincts take over.
Think so?
And you know, you need to be able to bring that patient in, and an immediate triage needs to be done. Nurses will surround. If the person is coming in by ambulance, then you've got information from the ambulance drivers as to the condition of the patient.
Actually, the information is here before that patient even gets here, through
yes.
radio, communications,
Absolutely.
probably even test results here, and all kinds of things.
Absolutely.
Introduce the person that we're going to be talking to today.
My pleasure. Dr. Todd Duthaler. Dr. Duthaler is Chief of Emergency Medicine.
Now, that's quite a title.
And media trained.
Takes someone special to hold that position, don't you think?
Absolutely it does. Experience, energy, vision.
He's a pretty young guy, though. I mean, what does he know about emergency medicine?
Oh, you'd be surprised.
Really?
You'd be surprised.
Are you just an administrator here, or do you actually work a shift?
No, I do plenty of clinical shifts as well, day shifts, night shifts,
Really?
weekend shifts.
So still hands-on for you in this
Still
department.
hands-on quite a bit.
Now let's take just a second. Before we get into what we're talking about today, let's talk about this new revision of the emergency room. If you've been in here before, you will not recognize what is here
You will
now.
not recognize.
It is stunning,
Yeah.
gorgeous, but yet looks state-of-the-art, so bright and clean.
I think, and Dr. Duthaler would agree with me because he was part of the planning team, that it's not just about beauty, it's about function and efficiency. It's about privacy. Anyone who remembers the old emergency department, oh my goodness, your business was everybody's business.
Yeah, one cough on one side of the room could be echoed across the other side.
Absolutely. So we have so much more privacy now, and I think it makes it easier for the staff to work. There was a learning curve, certainly, but it makes it easier to administer care.
We're going to sit down and talk about this department, but first you went and scarfed up some information for me. About how many people work in this department?
We have approximately 40 individuals who work through the nursing department, a combination of RNs, LPNs, nursing assistants, and work clerks. Okay, work clerks are very, very important You know, they help to get the doctor's orders going, etc. So they're an important part of the
A lot
team.
of times you're chasing medical records around these hospitals too, for a patient or getting information around, right?
Hopefully we don't have to, because almost everything is done electronically.
Really? So the computers are able to
the
zap you
computers
with-
are
that's
able
great.
to have us instantaneous access to all of your previous records that were done here in the hospital. So we can even view imaging studies. If you had an X-ray or a CAT scan earlier in the day and you get referred into the emergency department, we can review that film right on the screen, right as soon as you get here.
But we're in this private room and someone is just entering this room now, so that it's really going to be private for the patient. Each patient will feel much more comfortable.
Right, and we still do have a combination of two-person as well as private rooms. We didn't build it completely private rooms because we wanted to maximize the number of beds that we could have.
Because there are times that this facility is still full.
Even the first week that we were open, we had all our beds full. Going from 13 to even up to 21 possible rooms. We were full the first week.
We have nursing staff, we have board clerks here, and we have physicians.
Physicians and what we call physician extenders, physician assistants or nurse practitioners, correct? And Dr. Duthaler can speak to those numbers.
We have approximately 10 physicians that are on staff here in the emergency department, and we have approximately 15 physicians, assistants, and nurse practitioners that work through. We do have a core group of people who dedicate the vast majority of their time here, so we have a lot of consistency to our staff as well.
Now, in all the stores and businesses I go in, one of the questions I ask everyone is, what hours are you open?
We never close.
24 hours a day.
24/7. We do
Every
have it.
holiday.
We receive a lot of phone calls wanting to know what time Fast Track is open. We have a separate area in the emergency department where we see less acute problems that's staffed by the physician's assistant. We try to discourage people from planning their visit as to what times they're open. We would rather people come in when they feel the need to come in. But just so you know, you can come in anywhere from 10 in the morning until 11 or midnight, and the Fast Track area is open.
If there's something going on in our counties, in our communities, it doesn't matter if it's an explosion, a building burning down, or whatever, gunshot wound someplace, this hospital knows what's going on. It becomes the hub of everything afterward.
Yes, immediately.
We have communications, obviously via telephone, but also with EMS radio, and they can call us, notify us of any major incidents that are going on ahead of time, so we can activate a disaster plan, which is in coordination with the whole county, with the fire departments, with EMS, with police. For the average emergency call, they call us ahead of time, give us 5 or 10 minutes notification that they're coming in, and again, we can plan and get a specific bed ready for them, so we know they're coming.
That's great. So there's a lot of coordination going on here. So you have master plans. Do you ever practice those master plans?
We do drills on all of our, I'll use the phrase disaster, but all of our emergency preparedness plans are tested on a regular basis. Yes.
Whenever you get a quiet time here in the emergency room.
And many times we will plan them ahead of time. You never know what's going to happen, and I've been involved in drills that take place during a very busy shift, and all of a sudden we have to change gears to ramp up for a major emergency in the middle of a busy shift, which is reality.
Do you ever get involved in any of those?
I do.
Do you?
For external disasters, I end up being the chief communications person. So it really depends on the nature of the
So if we were
disaster.
looking for information on his story or something, we would come to you for that information?
Yes, 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 yes. Now, you'd probably go immediately to the switchboard, and the switchboard would put you in touch with me. Yes.
It's a lot of responsibility.
It
You
is.
enjoy it though, don't you? You really like your job.
Oh, I love my job. I absolutely love my job. And it is a lot of responsibility because you never want to let information get out prematurely. You have to
Wrong
make,
information.
absolutely, absolutely.
And
So,
it does happen.
you know,
because people-
fortunately, you know, in the 18 years that I've been here, we've had very few major disasters. But we always prepare for
You
them.
never know. That's right. And that's what we're part of. We want to be here if you need us. And thank God you're here when I need you. Because I also have had to come to the emergency room, and you said you've been here as a patient. How does it make you feel to pull in that parking lot and know there's somebody inside, the lights are on, and there's somebody here to take care of you?
When you're in pain,
Mm.
oh my gosh,
It's scary.
it's just, you can't get here fast
It is
enough.
emotional. It is very emotional. And that's part of being a doctor, I guess, is you have to be smart enough to know what's going on physically, but you got to be there, prepare, and mentally help that person through that emotion.
And you have to be compassionate too, and understand that although that particular person's problem may not be life-threatening in my eyes, to them it's a major issue that they need addressed right away, and I need to act on it as quickly as I can. Residency in a small community hospital outside of Philadelphia, and while I was thumbing through some magazines one night, some journals, I saw an ad to work for the group in Saratoga Springs, and called them up and got the job 11 years ago, and I've
Wow.
been here ever since.
What do you think of this area?
I like it. I really do. It's a fun place to be, more so in the winter for me. Than,
Really? You like the winters?
Yes.
Really? I'm just the opposite. I hate the winter.
No, I like the snow, I like the cold.
And that
20
brings
below
patients
and
in too.
snowing and
it doesn't matter if it's the heat or the cold, it brings patients into the emergency room. Any extreme seems to. Do full moons affect what goes on here in the
We feel
emergency
like
room?
full moons make things worse.
Really?
I don't know if I've ever read anything statistically that says it's worse, but we all think it's
You
worse.
cannot anticipate when you're going to have a full house here.
No. No. It can be 8 in the morning, it can be 8 at night, it can be anywhere in between.
So how do you feel? What does your title encompass? What are your job responsibilities here at Naval Lieutenant Hospital?
Anything and everything to make the emergency department run smoothly and to ensure that the patients are getting quality medical care.
So in your time here at the hospital, you were able to get a new revamped facility.
I took over as the director from our previous administrator who had moved to another area right at the beginning of the renovation project. So I was involved in this project right from the start, and ultimately very happy, very pleased with the way it's come out.
Don't you feel personal, like this is your hospital and pieces of it are yours? Don't you become part of it, the staff, and become part of this place? Right?
You do, and you become very good friends with many of the staff members that work here. And the other thing that I always like to tell people when they come to interview with us, or that the nursing staff and the rest of the hospital staff that's caring for you are your friends and neighbors, because they live right in town. And they would never want to do anything that would intentionally cause you more harm, or to wait longer, or to be more uncomfortable.
And even the emergency staff, the ambulance folks here, I mean, you get to know them as friends. You know them by name, by face, and they're helping you a lot of times when they come in. I mean, they stay in and work with you, transporting the patient to where you need them and everything. So we really have great emergency services here.
We do, and we're actually at a very key point for regional emergency medical care, as you and I were talking about before the interview. We're in the process of coordinating for regional paramedic and EMT protocols that will be the same across the area extending from the Catskills all the way up to the Canadian border, and from Utica to Massachusetts and Vermont. Everybody will have a single unified protocol, which makes it a lot easier for the guys and girls working out there on the streets to... And it's basically just a large room that has enough room for plenty of staff members, for lots of equipment, and for a lot of things to happen all at one time. We have specific carts, as you're looking at now, for pediatric emergencies, for adult emergencies, for airway emergencies. We have ultrasound capabilities that we can bring right into the room here. Behind the cabinets on the opposite wall over here, we have a lot of other specific pieces of equipment that we don't need to leave out all the time.
So it's amazing. And not only the equipment, but the supplies alone, down to bandages and medications as well. I mean, do you have medication here? You must have some sedatives and painkillers here in the department.
The vast majority of our medications are managed in a hospital-wide electronic medication dispensing system, where we enter the patient's name and the order from the computer, because all of our orders are entered directly into the computer by the physician. The nurse is then pulling out the specific medication that agrees with the physician order, so there's much less of a chance of a medication error. And then they bring that medication directly to the patient's side. They will then scan the medication. All meds have a barcode on them. The patient's wristband has a barcode on it, and they scan the medication and the wrist to make sure that everything matches, so we're not having issues with medication inaccuracy.
And as you mentioned, you get every age person in here.
We do.
Adolescents, young children, as well as adults, right?
We do. Everybody right up to birth. I have not had to deliver a baby down here. And I'd like to keep it that way. But
this would be the room that you bring them into?
We would bring them in here.
Oh,
when expecting mothers do come in ready to deliver, we give them a real quick, hi, how are you doing, what's the situation kind of assessment. And if we feel that they're stable enough, we take them up to maternity and let the maternity experts take over from there.
And what do you think of that? I mean, you get to touch all the different departments in this hospital, the surgical wing. I mean, you really are very well set here in Fulton County.
You really can't talk about the emergency department without talking about the whole hospital, because it's true. We do interact every day with maternity, with the surgical services, with the intensive care unit, with the lab, with diagnostic imaging. Every single department in the hospital interacts directly with us, and none of us would be anywhere if it wasn't for the housekeeping staff.
You're exactly right. I mean, what would you do without cleanliness and sanitary conditions?
Right.
And we'd be creating more problems. Let's talk about our walk into the emergency room. If someone comes in, you've got a new entrance. You even have parking now for emergency. They don't have to park over in the parking lot and walk all the way over. You have convenient emergency parking. Looks like there's a lot of spaces out there. They come in now, come into the emergency room, and now there's someone right at the window that will greet you.
Right, and in the ideal situation, that person is not talking with another patient at that time. So they would bring you right in and start the process that we call triage. And what that is a few-minute interview with the patient to determine on a big picture what's going on. What problem are you here for today? How long has it been going on? And what are your other medical conditions that we need to take into consideration?
And as tough as it is, family members need to realize when you bring someone in the emergency room, you yourself need to be calm. That will help not only the patient, your loved one, but it helps the doctors and nurses really assess what's going on. You get 2 or 3 people all talking at the same time. It just makes it a confusing situation for you folks, right?
Right. Especially when family members or the patients themselves get upset and start saying, well, I just need to get in, I just need to get in, get me in a room right now, I need to be admitted right now. Answer on that. It's a very personal decision that you have to make. We receive 10 or 15 calls a day some days. I have this, that, or the other thing, do I need to come into the emergency department now? And our answer across the board is, we can't make that decision for you. If you feel that it's important enough that you need to be seen right away, then you're more than welcome to come in.
It doesn't always have to be life-threatening, as you said, a grain of sand in someone's eye, a cut, a cough, back pain, whatever. I just heard a child's pain, it's just, it makes you, it's a good thing there's a staff here to take care of this, because it's nothing that I would be able to do.
And we will see anything and everything that comes through the door, and we'll evaluate it to the best of our abilities.
Sometimes it's a fight to help someone too, to save their life.
Most people cooperate with us. We don't have to fight with too many people.
No, but I mean, like trying to save a patient sometimes,
Yes.
a severe heart attack or something.
It can be very difficult, and that's one of the things where your years and years and years of training and your years of experience come into play, where you almost act out of instinct as opposed to sitting and thinking through every decision that you have to make.
It's physical for you as well, don't you think?
It can be. Many things that we do on a daily basis require a little bit of strength, a little bit of,
Lifting
and
moving
tugging and
equipment.
pulling, and A lot of walking.
Chest compressions. I mean, that
Yes.
really, if you've never done CPR or anything, that is really physically laboring to the person doing that.
And that's why the American Heart Association wants everybody to change compressors after 2 minutes.
Really?
Because it's very, very
And
energy
you have to
intensive.
do you do those? You must have to do those
We
things.
do.
to get your, good thing I'm not here to see that, or I'm the patient, either one. We're going to take a break. We're going to be right back at Nathan Littauer Hospital. We're in the emergency room. We are back, and that's something else we were just talking about during the break, swine flu. This year, not an issue, really, right?
The flu season, at least to this point, seems rather mellow compared to previous years. The strain of flu that we called swine flu is out there, and people are getting it, the same as they get the regular flu. The flu vaccine this year, for those of you who haven't gotten it, I urge you to get your flu shots now. There's plenty of supply. The flu vaccine does contain the swine flu portion to it this year. So you don't have to worry about two separate.
Over time, kind of help diminish
Right.
the issue.
Right.
And again, even as something as technical as the swine flu hits your department, comes on your desk, and now you think, oh my gosh, I'm going to have to learn about this, I'm going to have to find out how it's going to interact, and how do I get the word out there?
This happens many times a year. Fortunately, I've got a great team of people to call and say, educate me quickly.
Because you need the answers, because folks are looking for you to be answered.
And answers in a understandable way, not in medical jargon,
Yes.
but
That wouldn't help me at all.
No.
And speaking of, I want to mention Larry Kelly, who wasn't in today's program, but Larry is a very hands-on person who is he's the chief officer here for this hospital. But he is right on top of everything. You have no problems walking into his office to go talk to the executive director of this hospital.
His door is open all of the time, and he welcomes us anytime we want to come in, whether we call ahead or not. He's a phenomenal person to work with. He really does support our decisions. He lets us make the decisions, and he supports us in everything that we want to do.
I would love to come back sometime and get a little bit more technical. I'd love to meet some of the nurses and the staff that run this department. And something we learned during the break after I faded out, this is not the emergency room anymore.
It's the emergency care center.
Because there's a lot of rooms here now.
Well, not only that, but it truly is a center where many disciplines come together in the care of a patient. And that is a trend, and I don't like to say that we go for trends. We don't do that easily. We make careful, considered decisions about this kind of thing, but it really is, it's reflective of what we do here.
It's exactly
It's
what
a
it is,
center.
an emergency care center. And I am just so glad that you're here, and I'm very glad to have the physicians that are here, the nurses that are here, that can take care of any issue, not only for myself. I would be deathly afraid if something happened to me, but when something happens to a loved one, you feel helpless all of a sudden, and you're the help. So I'm just really glad that the services are available here for me at Nathan Littauer Hospital. And we're going to end our